Hello. Uh, Good evening, everyone. My name is Dr. Nsofor, and I'm going to be giving a talk today on the topic healthy heart, given that February is the National Heart Month. Um, and I'm going to start with the presentation. And pretty much the topics that we're going to cover today is I'm just going to be giving a brief introduction to what heart disease is, and also we're going to jump to the causes of heart disease, like what causes heart disease, and also the signs and symptoms of heart disease that if you're having the things to look out for. And also, we're going to cover on knowing your risks, what it entails for the risks that if you have increases your chances of having a heart disease. Then we're going to also list on steps for prevention of heart disease. And lastly, we're going to touch on living with heart disease, which also um, touches a little bit into uh, knowing your risks and also the things that you can do to mitigate that from actually causing heart disease, or while you have the heart disease, to if you're living with the heart disease, the things that you can do to prevent you from running into some problems. In terms of the end results of heart disease, which is a heart attack or a stroke, or also what we call heart failure. So we're going to start with the introduction. So pretty much heart disease is caused by a reduction of blood flow to the heart. So pretty much it entails when your arteries that supplies blood to your heart is pretty much cut off because of some blockages. So that's pretty much the number one leading cause to heart disease. And heart disease is also the number one cause of death in the United States. And about 4.6% of the US adults has been diagnosed with coronary heart disease, and about 1 in 16 women aged 20 years or above have coronary heart disease, which is pretty alarming. And also a little bit of stats out there. About 1 in 13 white men and 1 in 14 of black men have coronary heart disease. Um, so we're going to go into the causes of heart disease. So what actually causes heart disease? So if you have high blood pressure, diabetes, your cholesterol is high, obesity, and so pretty much obesity, we classify that as if you have a body mass index that is greater than 30, and if you have an unhealthy diet, and if you smoke, and physical inactivity, or pretty much you don't exercise at all. And also stress, believe it or not, can also cause heart disease, or is linked to some, or it can increase your risk of having heart disease. I'm going to touch on that a little bit later. So the signs and symptoms of, of heart disease, what you should look out for is one, chest pain, which is the most common. So if your chest is hurting, it can come in different ways. Either some people describe it as a crushing pain in the chest, or like an elephant is sitting on their chest, or a pressure in the chest. That should alarm you that that you might be having some form of heart event, mostly a heart attack. Also, if you're also with the chest pain, if you're feeling short of breath, or also if the pain is radiating to your left arm, and some people also describe it as radiating to their jaw or their upper back, that's also a red sign that you need to go to the emergency room to have it checked out. Also, with indigestion or heartburn, which mostly elderly females present with, because they don't present like your typical like your typical signs of sharp or dull chest pain, like other adults present with. So that's also a sign that something might be going on, especially if you have the other risk factors that I mentioned previously. And also, some people might also have some nausea or vomiting associated with the chest pressure or chest tightness, and also excessive sweating. And also, one thing to notice for people who also have long-standing diabetes, they might not even have chest pain at all. They might have other symptoms that are listed above, like shortness of breath, or the nausea or vomiting, or excessive sweating. So, if you do have the risk factors like I mentioned above, in terms of the high blood pressure, diabetes, and high cholesterol, and you're having any one of these symptoms, it's something that at least you should call your doctor about to determine what next, whether you need to go to the emergency room to have it checked out. So, we're going to talk about knowing your risks. So, what are the risks of having heart disease? And I mentioned a couple above, but these are the things that you can be able to do. So, one is by checking your blood pressure. And all these things can be done by at least having a yearly physical, which you go to your doctor, and all this can be done. So, one, know your numbers by checking your blood pressure, and also checking your blood glucose level to see if you are diabetic. And also, like I said before, going for a regular wellness visit to also check your cholesterol level. And very importantly, is by knowing your family history of heart disease, if this runs in your family, especially heart disease at a young age. And when I mean by heart disease at a young age, especially if you have a father or a brother who had a heart attack when they were less than 55 years old, or you have a mother or a sister who had a heart attack when they were less than 65 years old. So we go to what can be done to be able to prevent heart disease. So this is more on the prevention side. So one, we talk about healthy diet. And the things that you can do to ensure that you have a healthy diet is one, you can control your portion size, especially, and I know sometimes I'm guilty of this, but uh, if you know, especially if you know that you have some like problems like eating large portion sizes of food, you can actually cut down on eating small bites and pieces, or even more frequently throughout the day than large portions at a time. And also try to incorporate more vegetables and fruits, and also try to select whole grains instead of just pure carbohydrates like white bread, and also limit unhealthy fats. You can look at the labels of the food products, and usually if it says that it has trans fat, just try and avoid it. And you should try and the saturated fats in the food label should usually be less than 6% of your total daily caloric intake, which the recommended dose for a healthy adult is 2,000 calories in a day. And also, some of the acceptable fat that you can take are things like, especially if you're using it to cook, like olive oil, vegetable oil. Instead of using butter, you can use margarine, then nuts, seeds, avocados. Things to avoid: bacon fats, lard, butter, like I mentioned, gravy. This also might be shocking, but the cocoa butter and chocolates too are not a good kind of fat for you. Then another big one is tobacco use, especially uh, the people who smoke. And these are the ways that you can, and tobacco use actually is one of the biggest factors that contribute to heart disease. And some of the steps that you can take to avoid this is one, to make an agreement with yourself to quit smoking. And you can also ask your primary care doctor for some information and some programs that may help you to try to quit. And also, there are some medications, especially if you need help trying to quit. There are some medications that you can be placed on that you can talk with your primary care doctor to see if you can be started on to see if that can be able to help you to quit. And also try to avoid being around areas and around people that smoke. And sometimes you can reward yourself uh, when you actually quit smoking, because sometimes that can also give you some form of like positive feedback in order to encourage you to keep on or to keep on not trying to smoke at all. And also remind yourself of the reason why you're trying to smoke, which is pretty much because you're trying to cut your risk of having a heart disease so that you can be able to stay healthy longer for your loved ones. And also, you can also ask your family and friends for support to try and quit smoking. Then another important thing, like I mentioned previously, is to know your numbers. And these are pretty much numbers that when you go to your primary care doctor for a wellness visit and they check your blood pressure or they check your blood sugar and they check your cholesterol, what does those numbers mean? So one, for your total cholesterol, you don't have to focus on the numbers, but I'm just pointing this out in case for some reason you tend to be one of those people to try and read through your test results. So the numbers to look out for is for your total cholesterol. It should be less than 100. Then your LDL, which is your bad cholesterol, usually should be less than 100, but 120 is also acceptable. Then your HDL, which is your good cholesterol, actually is the other way around. It's supposed to go up. So it's usually good when it's greater than 50. Then there's a test called your hemoglobin A1c, which is supposed to check pretty much like a summary of what your blood glucose level has been in the past 3 months, and is also a good way to be able to find out if you have diabetes. So usually when that number is less than 5.5, that pretty much tells you that you don't have that diabetes. But when it ranges between 5.5 to 6.5, then you are at a higher risk of getting diabetes. And when it's more than 6.5, then you are pretty much diagnosed with diabetes. Then for your blood pressure, usually it's best when the blood pressure is less than 130, which is the systolic, over 80, which is the lower number, the diastolic. Sometimes blood pressure varies throughout the whole day, especially when we're stressed, we're angry, or we're frustrated. That should not point you towards trying to go to the emergency room if your blood pressure is like 160 over 90 or over 100, especially if you're in this kind of situations. The best the best way to actually measure your blood pressure accurately is to keep yourself in a quiet, calm room, turn off all the lights, feel relaxed, and then take your blood pressure. That's the best way to get the most accurate reading for your blood pressure. And if that consistently stays high, then you know that your blood pressure needs to be, your blood pressure medication needs to be adjusted if you're on blood pressure medication. Then, if you're not on blood pressure medication, then that's the time you need to go see a doctor to be able to figure out what you can do to reduce your blood pressure. Some people, if you can make some lifestyle changes like limiting the amount of salt that you eat in your food, and also even exercising, or even those who smoke to stop smoking, that can actually even control your blood pressure without you actually be placed on some blood pressure medications. Then another important one, which is supposed to help reduce your risk significantly for heart disease, I cannot stress this enough, is exercise. No matter how small especially if you're not used to exercising at all. No matter how small you start, even just by walking around your apartment or your house, maybe even 10 minutes a day is extremely way better than not doing anything at all. But usually, the American Heart Association recommends for the optimal amount of exercise that you need to decrease your risk for heart disease is usually 150 minutes of moderate intensity exercise in a week. So that averages out to about 30 minutes of moderate intensity exercise per day for 5 days in a week. So usually an example of those moderate intensity exercises are things like if you can jump rope or brisk. Actually, jump rope is intended as a high intensity exercise. So moderate intensity exercise are for people who like aerobics, swimming, dancing, gardening, and also brisk walking. uh, that is regarded as a moderate intensity exercise. And they also recommend that you can also add at least in 2 days out of that 5 days in a week, a high intensity exercise. And high intensity exercise, an example of it is like running, jump rope, swimming like multiple laps in the pool, and also doing like yard walk that in that entails like constant digging or moving around things around your yard. That those are all regarded as a high intensity exercise. And as I said before, Rome was not built in a day. So you can literally, if you're not used to exercising at all, you just getting up, even at work, there are little things that you can do. Like instead of taking the elevators at work, take the stairs. If you're going shopping in a grocery store, instead of parking close to the entrance of the store, why don't you park farther in the parking lot and just walk the rest of the way and walk back to your car? Little things like that, if intentionally done daily, can increase the amount of exercises that you get in a day, and that overall helps your heart. Then another one, which is most people don't actually know, is that stress, especially excessive stress, has been linked to an increased risk in heart disease. And it has been postulated that stress increases inflammation in the body, and that also the inflammation in the body, especially in the arteries of the heart, leads to buildup of like what we call plaques that actually clogs up those blood vessels. So ways that you can actually reduce your stress is one, the most important is to try and get as much sleep as possible at night. And like we talked about exercising, the more exercise you do, the better uh, the better for you. And also carve out some time for the things that you will actually enjoy doing in life to try and reduce your stress. If it's spending time with family and loved ones or friends, that can also reduce your stress. And also for some people who have hobbies like traveling, if you can do that, that can also help also. And also even just by seeing someone to like talk to about your daily struggles and also some problems that you might have can also reduce your overall stress. So in to conclude this talk on the healthy heart, the American Heart Association actually came up with something called My Life's Simple Seven. And pretty much, this entails the seven easy things that you can do daily to be able to limit your risk of heart disease. And usually, the reason why they did this is because it's something that everyone can do. It's free. It's simple. And if you're mindful of this, you can easily and drastically reduce your risk of having heart disease. what is my life's simple seven? So, number one, like how we talked about, is to manage your blood pressure. Like I said, at least for people who already have a diagnosis of high blood pressure, just by you checking your blood pressure at least once a day, especially in those ideal environments that we talked about earlier to get the best accurate result of your blood pressure, that can also help too. And also, secondly, the second step is to control your cholesterol. For those who have high cholesterol, and for those who don't even want to get there in the first place in terms of prevention, you can control that by watching what you eat, like how we talked about avoiding trans fats. And if you're reading the food labels and trying to actually the other fat substitutes that are actually healthier for you, like avocados, nuts, and seeds, that can also help you overall to reduce the amount of cholesterol that you consume and overall actually help your cholesterol profile. Then the other one is to reduce blood sugar, especially if you can reduce eating simple sugars. If possible at all, if you can even cut it totally out, that would significantly help you, especially with simple things like cakes, cookies. You can actually eat more healthy snacks, like almonds, nuts more than actually the cookies and the cakes. That will help a lot. Then the fourth one is to, like how we talked about, is exercise. Get active. No matter how small of an exercise you do a day makes a huge difference than just not getting any kind of exercise at all in a day. Then the fifth one, like we talked about, which also piggybacks on number two and three, is to eat better. Then also, like how we talked about earlier about obesity, also being a risk factor for heart disease. So weight loss. If your BMI, which we talked about earlier, is if your body mass index is greater than 30, that means that you are on the obese side. And for you to be able to lose weight, there are many things that you can be able to do. Some people it's kind of genetic, but you can be intentional by the other things that we talked about in terms of a healthy diet and exercise, which is the two key most important things to be able to lead to weight loss. And lastly, for those who smoke, is to completely quit smoking. Initially, back or earlier, was believed that by cutting down on smoking, that you actually cut down your risk of heart disease. But no amount of smoking at all is healthy at all. So it's actually best or optimal to quit cold turkey without even smoking at all. And these are pretty much the seven simple things that you can be able to do. And you can actually even start today to be able to reduce your risk of heart disease. So, this pretty much concludes my talk on a healthy heart. And I just want to encourage everyone that this is highly attainable. It only the decision pretty much relies on you, and you can easily do this to be able to achieve a healthy lifestyle, and by that, having a healthy heart. Thank you, and thank you for your time today. And I'll be willing to answer any questions for those who have any questions. Thank you.